Yes, so I'm going to introduce Plum Stone, third time lucky. So you've been waiting for it. So Plum is the CEO and founder of the Safer Air Project. Plum is known to many and all, I would say, but it is important to acknowledge her contribution and efforts. She's worked in health policy and public affairs for the last 20 years with a focus on patient advocacy in cancer and terminal illness. As a result of her professional background and also her personal lived experience with an immunocompromised and high-risk family, she founded the Safer Air Project with a mission to have indoor air quality recognised as a critical accessibility and inclusion issue for people living with chronic health conditions in order to make indoor air safer for everyone to breathe. So Plum will say a few words about today and also the Safer Air Project. Thanks, Plum.
Thank you, Suman, and apologies for it's the draft and the division bells that are throwing us off. We're just flying by the seat of our pants here, and we'll get there in the end. Good morning to everyone, and thank you, Suman, for your support, as well as Burnett's support, and for being here to moderate this opening session. As Suman said, I'm Plum Stone. I'm the founder of the Safer Air Project, and it's really wonderful to welcome you all here today for our second Safer Shared Air event in Parliament House. Before I begin, I too would like to pay my respects to the Ngunnawal and Ngambri people as the traditional owners of the land on which we gather today, and pay my respects to elders past, present and emerging. I'm delighted to have been able to welcome Senator Nandaraja this morning, and glad that we could get her out of here before a division in the Senate. Unfortunately, we are struggling with divisions in the lower house, which is keeping Assistant Minister White from being here. But don't worry, Academy, I'm assured that she is coming, and she will do the thing that she's meant to do when she gets here. We're also delighted to welcome Dr. Amanda Cohen, MLC from New South Wales Parliament, and all our distinguished guests, and especially Lydia, basking in the glory of your amazing week this week. Thank you to our supporting partners, AERA, the Australian Academy of Sciences, and the Burnett Institute, and to our sponsors, the Cainro Foundation, QED, and others here today. Before Assistant Minister White kindly opens our event, which will happen when it happens, I would like to share a little bit about why the Safer Air Project was founded and set the scene for the day ahead. And the short answer is, it's because something as simple as breathing in shared indoor spaces has become a barrier to accessibility and inclusion for millions of people, and it's time to change that. So, as many of you know, at the start of the pandemic, my family were infected. My daughter suffered a prolonged status seizure and was hospitalised. I went on to develop long COVID, and the consequences of that initial infection have lasted for years. As a policy wonk who wrote their undergraduate dissertation during SARS-1 on learning the lessons of pandemics of the past to prepare for pandemics of the future, despite the personal health impacts I was now experiencing, I was also nerding out. Ooh, airborne! What does that mean from a policy perspective? What tools and technologies do we have to prevent transmission? How do we implement them? How do we do so equitably? And where do we start? Additionally, my background working in cancer policy meant I knew all too well that people living with chronic health conditions were at increased risk of poor health outcomes from infection. And I couldn't help wondering about the risks for so many people in a pandemic situation. Indeed, like the 1.2 million Australians living with a current or past diagnosis of cancer, my own husband was identified as being clinically vulnerable. We recently celebrated our 10th wedding anniversary, and I thought it strange to remember that we used to party the night away without worrying about the air we shared with our friends and family. The reality is, we are not alone. 1 in 2 Australians lives with a chronic health condition, like cancer, heart disease, asthma, diabetes, with similar stats around the globe. And I'm delighted to welcome here today representatives from patient organisations like Asthma Australia and the Heart Foundation, Immune Deficiencies Foundation Australia, Emerge Australia, Cystic Fibrosis Together, and I hope I haven't left anybody out, but thank you for joining us. This really matters to all of your communities and so many more. Because we're in every classroom, in every workplace, and every community. And as I began to discover airborne pathogen transmission predominantly occurs indoors, in poorly ventilated spaces, I also started to see that shared indoor spaces now posed a significant risk to my family and millions like us. It's an invisible barrier. Suddenly safe participation in everyday life was no longer possible. No, sorry, we can't go to that indoor birthday party. No, sorry, you can't go on the bus to the excursion. Mummy's going to drive you. No, sorry, even accessing healthcare is going to be difficult because our systems are still catching up with the fact that airborne infections require airborne solutions. That's why last year we founded the Safer Air Project and launched our report to get indoor air quality recognised as a critical accessibility and inclusion issue. And there are copies dotted around. If you haven't had one, please do pick one up. The reason we did so is because we truly believe that everyone deserves to breathe safely indoors without risking their health. Collectively, we've made progress, recognising signs, ramps, lighting, assistive audiology, and others as essential accessibility features for inclusive design. But what about the air we share indoors? We need to start connecting the dots. We all breathe the same air, but not with the same consequences. For people with chronic health conditions who face a disproportionate risk of harm, unsafe air means unsafe spaces. People are disappearing from public life, and health shouldn't be the price of participation. And of course, it doesn't have to be this way. When I walk into a space and can see that the air quality is good, it's good in here today, which is great, I can't tell you how much of a weight is lifted. Like at our local cinema, where I take my kids, and we eat popcorn without worrying about whether it's safe to unmask. Responsibility for staying safe shouldn't rest on the immunocompromised or high-risk person, especially when that person is a child. We wouldn't expect a child to boil water to make it safe to drink. We need to stop asking them to be responsible for the air they share in their classrooms. This is solvable. We have the tools: ventilation, filtration, disinfection, real-time air quality monitoring. What we need now is a commitment to act, to mandate IAQ performance standards, and to visibly display real-time data for everyone to see. Because it shouldn't be on the high-risk person to have to carry a monitor, or indeed to have to mask. Indoor air quality performance standards that effectively reduce the risk of exposure to airborne pathogens and other pollutants would make safer indoor air the norm, and not the exception. Safer indoor air improves learning, well-being, productivity. It lifts everyone, but it especially protects those most at risk, even if you can't see who they are, and they might not know themselves. That's why we're raising awareness of IAQ as an accessibility issue and advocating to make the invisible visible. If the act of breathing in a space makes someone sick, access isn't equitable, and it's time to change that. Together, we can create a world where everyone breathes safely indoors, and I look forward to telling you more about the campaign later on this afternoon. So thank you all for being here. I'm going to hand over to Suman to introduce Dr. Amanda Cohen. Thank you.